It's time for another edition of Wellness Wednesday with Dr. Bradley Meyer of the Okoboji Wellness Clinic. Good morning, Dr. Meyer.
Morning, Dave.
Well, we're going to talk about inflammation and pain today.
Absolutely. There's a lot of that going around. So especially when it kind of gets back cold again here, everybody can feel it in their joints. And, we have things to do here that can really make a pretty quick impact on people's pain.
Well, let's talk about it. I've heard you've had some success over the past few weeks.
Oh, yeah. Pretty significant. We actually had 3 folks that have come in here and dealing with some back pain, some tailbone pain, and just overall the feeling of I'm tired, I feel inflamed, and, I can feel every bone in my body kind of thing. And so, a lot of these folks we'll find have had some blood work done, and they're told, hey, that everything looks good. The blood work is, fine. But then you're saying to yourself, well, why am I still feeling so poorly? I'm not feeling myself. I'm feeling inflamed. I've got pain. And so there is a lot of clues in that blood work that we do, that we're every day here I'm working through blood work and looking for clues as to what is it in that environment that is inflaming the body, keeping the body out of balance. And so the cool thing is, in the meantime, while we're working on identifying those toxins, those triggers, those things that are keeping the body out of balance, keeping the body inflamed, there's a few things that we can do to really reduce that pain in a big way quickly. And in a lot of times it's what we call the biostacking, where we're utilizing several different modalities while we try to go down that road and figure out what is it that's inflaming that individual. So one lady, that she had a compression fracture, and that's where it's due to decreased bone mineral density in the spine. One of those vertebrae collapsed, and she could barely move around or get out of the chair. And so we got her going on the Hyperbaric Therapy again, which, as we've talked about so often, is so huge for inflammation, so huge for so many chronic conditions, improving immune system and helping the body bounce back faster. Well, we got her going on some Hyperbaric Therapy. We got her on the Wellness Pro, which is a frequency device that we've had going here since this last fall. Now, that's FDA approved for pain management, and it is lights out for so many people here, and it's using frequency to help the body get into a better state, into less inflammation. So a lot of times we're going to see that people have a history of, the TENS unit that their physical therapist will use. Well, this therapy, this Wellness Pro frequency, is using a much broader range of frequencies to approach the body to help with that inflammation. Then the third step is it's kind of like a light wave technology. It's a crystal type technology that's body heat activated, and this was the game changer. When we added this on to these other couple things, we placed it's a type of patch again, and you locate that pain, and it's based on the meridian. So the body has a grid or a pathway where energy kind of flows through the body, and certain types of conditions, now we're talking pain, this type of approach, when you find that right spot with that patch, we saw incredible relief. This was yesterday with somebody that came in with tailbone pain, been out farming, working with the cattle, all the things, and just struggling. Just nothing he was doing was getting him past it. Did that, and he had near immediate relief. So he was pretty shocked, and to say the least, is like, I've been dealing with it that long. And we got some response that quickly. So it's kind of a cool thing. Then again, we throw in sometimes some red light therapy, which is also going to reduce that inflammation. we can see some pretty significant changes and improvement in people's quality of life quickly. Because as you know, Dave, when you're in pain, that takes a toll mentally. You start getting down, you're feeling depressed, and so we want to be able to get you those answers and help reduce that pain. Give us a call, and we can do what we call a discovery visit. Those I do, where you're like, well, how do I plug into this model? Go to the Okoboji Wellness Clinic, and where I look at things, our team looks at things differently than the traditional system. We are looking at things, again, we talk about peeling the layers off the onion, getting to that root cause, but it's a 15-minute call, and it's complimentary, and you can just call the clinic, and you'll talk to me specifically, and we can see, all right, where do we start here? Because if you've got a lifetime of pain, or you've got a lifetime of chronic illness, disease, and you're just not making the progress you want to make, that's our area. That's our wheelhouse. We have folks coming in from a lot of different places outside of even Northwest Iowa that we've been blessed to work with and help them get on that wellness walk, feeling better.
One thing I've discovered over the last 3-4 years is some in medicine are taking a look at some technology and some treatments or modalities, as you might call them, that have been around for a while. This frequency technology, Royal Raymond Rife developed that technology in the 1920s. And it was already proven effective on many things back in the 20s.
Right. And the hyperbaric therapy has been around since at least the Spanish influenza. And so it's just these things were not taught. They weren't taught to me in conventional, traditional medical school. Again, I was taught that the pill for an ill. And so, you get the diagnosis based on the symptoms, and then we give you a pill. And that leads to hopefully reduction in some of your symptoms, but a lot of times it's just management of that disease process and slowing it down maybe. But most times, those things are not, most folks are not saying, give me more pills because I feel better every time I get on another pill. It's again, time and a place for those pills, for those prescriptions. Yeah, we do need them at times, but it's pretty amazing to think that there are all these things out there, these modalities, these technologies, and these approaches that I wasn't taught in medical school, and they definitely have a place. It's blown my mind, and the gentleman that came in yesterday was he was just astonished. And I think, again, David, you come back into the COVID era, and folks are saying, okay, this what's this ivermectin thing that's been around, and oh, that works really well for so many different things. And that started to open people's eyes up a little bit and say, okay, I don't have to accept that this is just aging for me, this inflammation, this pain, this I'm not feeling well, that there is more out there to look into these things, and people like these scientists of the years past, like a Royal Rife, using frequency. That stuff, it is really legitimate, and so much so that the FDA, that they're even talking about using it for chronic pain management instead of opiates, prescription opiates. So and so they're giving their stamp of validation to this frequency type of treatment. Now there's so many more other things you can use that frequency treatment for. That's just the top of the barrel.
Well, and I think what's happened to us as a consuming public, we sit down and we watch television at night, and we see all these pharmaceutical ads, and we think that that's the only way to go. Now, again, there's certainly a time and a place for pharmaceuticals, but I'm not sure it was ever intended that these pharmaceuticals would be with us for example, when you say a pill for an ill, I'm not sure it was intended to be then with us for the next 30, 40 years of our life.
Well, that wouldn't, whether or not it was intended to be or not by the powers that be, that's a great question, Dave. So, but, for sure, being on them, I like to look at them as more of a bridge. And the longer that disease state has been there and in place, sometimes it is more of a challenge to get off of the medications completely. That's why it's so important that when you come in and you say, oh, I'm on this pill for this allergy, or, oh, I'm on this pill for depression, and it's just one or two pills to start in your 20s or 30s, and at that point you're like, okay, that's not bad, but really we want to, that's our body telling us something is out of balance if you're needing to be on a prescription. So sometimes we need a bridge with these prescriptions, but when we're younger and we've had success in the older folks crowd as well, the broad range of help, but man, it is so much easier if we can get folks going 20s, 30s, 40s, and even 50s to get the ship turned around, and where that one or two pills doesn't turn into 5 or 6 pills, because it's again easier to get to peeling the layers off the onion to the root cause and get the body back into balance when we're only at 1 or 2 pills.
Well, I go back to when we originally started talking, and we're way out of time here, but one of your success stories was getting somebody out of a memory care unit with the use of hyperbarics. To me, that's just about brings tears to my eyes just thinking that happened.
I'm filled with gratitude, and that God has put us here in Okoboji, Spirit Lake, on this path, because, what an impact this can have on folks' quality of life and families, and to be able to participate in that, it's so life-giving. It's so much more than just continuing to add more and more prescriptions to somebody's medicine cabinet. So absolutely, that's what it's all about. It's these stories, and they're coming in every week, and I wish I had more time to share with them, because there is hope for folks. I think that a lot of times people get frustrated and they're just tired and not feeling well, and they're spinning their wheels.
Right.
And what I tell you here is that you come on in, give us a call, and we will get working on peeling the layers off the onion. And believe me, from cradle to grave, we've worked with all ages. We've been able to, with God's help, do some significant things to help people's quality of life, getting them feeling better.
And I want to make it crystal clear, you do believe there is a time and a place for prescription drugs, but you also believe you want to get to the root cause of why you're using that drug. Right.
So, again, everybody's different, the route that they want to go. Some folks really want to work to peel off as many of those layers as they can, but then that may mean some lifestyle changes as well. So if we want to get off of some of these prescription medicines, you've really got to be committed to making some of those lifestyle changes. So some folks will be like, that is a significant change for me, and I'm not feeling too bad. I don't want to rock the boat, and I want to stay on the prescription medicine. And that's okay. Everybody can do what they want to do. It's about the education process of giving you the choice of these are the different paths you can go, and then it's up to you which path you take. And we're here to walk alongside you and get you to where you want to go with you putting in the hard work.
All right, got to go. Where do people find you?
712-339-6024, and we are at 3305 Berquist Avenue in Spirit Lake.
All right. Dr. Meyer, always a pleasure. Have a great day. We'll chat soon.
Take care, everybody. Bye-bye.
Dr. Bradley Meyer. And you can find Dr. Meyer also online at Okoboji Wellness Clinic.com.